Hello, everybody. This is Tara here. So, for my blog today, I just wanted to talk about Tristan. Oh, not to mention this whole virus pandemic craziness that's happening. I don't even are we dreaming? Is this I keep thinking that we're all gonna wake up from this. This is a movie. I'm expecting Dustin Hoffman to show up with the vaccine and save everybody because this is just I don't even understand. Anyway, I wanted to talk about Tristan and what's been going on with him before we went into lockdown. 13 days and counting. The last place that I went to was the Children's Hospital here in Northern Ireland because my son had a doctor's appointment at the heart clinic because he has problems with his heart. Now, I knew about one problem, so let me just explain a little bit before I jump into the new problems with his heart that we didn't know about. So about 4 years ago, Tristan had seen a pediatrician at the Children's Hospital, Dr. Moriarty. I shit you not. That is his name. I was waiting for where's Sherlock Holmes? Keep him away from this guy because this guy ain't gonna like him. He's a lovely doctor though. It was so great with Tristan. So he checked Tristan's lungs and everything. And then after I knew something was wrong because he was taking a long time listening to Tristan's lungs. Well, I thought it was his lungs. And he says to me, have you ever been told that Tristan has a heart murmur? And I says, no, not once. Now, bear in mind, Tristan has seen a lot of doctors, obviously, and no one has picked this up. He says, because of Tristan's symptoms, now Tristan was referred to Dr. Moriarty because Tristan gets tired very easily. And at the time when he still was trying to be physically active, his legs would buckle underneath him. He would get a gray white. He would say that he could feel his heart beating really fast. And then he would be tired and they would lay on the couch for the rest of the day. So I knew that wasn't normal. So that's why he was initially referred to this pediatrician at the Children's Hospital. And then he says to me, because Tristan's symptoms and because of this, where the murmur is, he says, usually murmurs, they're nothing to worry about. He says, most everybody has a murmur of some kind, He says, but Tristan's murmur is up higher, which he says I'm not really happy with, so I'm going to refer him to the cardiac unit at the Children's Hospital. So we waited a year for that appointment. Tristan, I was you go in and you're there for 3 hours. So first you speak to the doctor, you tell the doctor the symptoms and why your child's being referred, and then they hook him up to an EKG, and then you go back to the doctor, and then the doctor, he was an older gentleman, he was lovely with Tristan, really great doctor. He was able to, I found it fascinating just by looking at the chart, from an EKG with all the swiggle lines. He was able to say to me, because there's a little blip, because of where it is and how it looked like, he was able to say it sort of indicates that Tristan has a hole in his heart. And he was able to say the name of it, that he thinks what it was. So he says we need to do a scan right away. So they scanned Tristan's heart, and then you wait and you go back and see the doctor. And so was seeing the doctor, and he says what it is when you're in your mommy, which I didn't know, when you're in your mommy's belly, there you have this extra valve, and as soon as you're born, the valve closes shut. He says Tristan's didn't, and he says the reason why we do need to, he says usually you don't need to worry about it at all, but sometimes when the child gets older, the valve opens more, which can cause problems for the heart. He says, so we're going to keep an eye on it and stuff like that. Tristan should have been seen last year, but the doctor retired, the heart specialist did. So then we were given to a younger doctor. Favorite doctor. So I fought to get this appointment. It was a year and a half. I was this is ridiculous. He needs a scan done every year, and it's been a year and a half since it's been done. Well, actually 2 years, because the last time he's seen was 2018, so actually it was 2 years. Sorry, forgive my 2 years. I don't even know what day it is. So we went in the beginning of March there. And they actually moved it to a different hospital. So they had brand new wing, new equipment and stuff. So bear in mind when you're having a scan, if you've ever had a scan on your heart, you know they press down really, really hard and it's very uncomfortable. And with that stuff they use, it can be quite sticky and gross, right? That for a person who's autistic is a nightmare. So Tristan, the first time, he screamed and cried. And my fear was she wasn't able to get a good look at his heart. And I was right. So they had another scan done, EKG scan done of his heart, and then we went in to see the doctor. So I told the doctor all the symptoms, that Tristan's actually gotten worse. It's the point where he doesn't run anymore. He doesn't, he's actually, he faints. He's fainted a few times from, trying to be physically active, not even running, just walking fast. He was in a play park and he actually fainted, and that was that was the first time, and that was the scariest situation I've ever had to say my child go through. So that was pretty scary. So his symptoms have gotten worse. Then the doctor says to me, okay, well, he's that something valve. He said the name of it, and I was like, yes, I know that. He goes, okay. He says there's other issues with his heart that sort of are concerning. And I was like, okay. Now I'm starting to get worried. And I knew something was wrong because they kept scanning the heart. We were there for a long time, and then we just kept looking at it. I knew something wasn't right. So he just says to me, they scanned here. Apparently there's a big vein, a big artery from your heart to here. So he says in Tristan's, it's actually thickened. He says usually that doesn't happen until you're 80 or 90. When you're an older person, that generally would happen. He says, but unfortunately that's happened with Tristan. He says the problems with that is, he says maybe Tristan could get to 50, maybe we could push it to 60, but he will need that stretched. Because obviously you can't have main artery, thickening like that. So I was like, oh God, okay, what else? And then he says, I need to show you, there's an issue with Tristan's heart. He says, I've never seen it before. So I don't even think they have a name for what this is. He says, it's just so strange. He kept saying, it's just so strange. I've just never seen this before. I just don't know. Apparently, with a normal heart, there's a valve where the blood comes out and into the lungs. And he was showing me Tristan's, and he says, Tristan's, takes twice as long. I don't know. It's just had a weird thing in the heart. He says what happens. So instead of it coming out, down and out straight into the lungs, it's coming out, down, up and around and out. So there's this weird thing, I don't know, that it's doing. And he says it's just, I've never seen it before. It's something in the heart that's making it do that. So I was like, okay. He says, so we need an MRI done. He says, I want to, that would give us a better picture of what is going on and why it's doing that. He says, also, I want my senior colleague to look at this, because he says it's just so strange. He keeps saying, I must have said it 10,000 times. So I'm like, okay. So that scares me. So he does have, now he's 3 issues. Well, I guess one's not his heart. One's, with an artery, but 2 issues with big issues with his heart. So, which would explain the symptoms that Tristan has. So he's been put on absolutely, no matter what, restricted physical activity until they can get a better picture of sort of what's going on and why, there's this, I don't know, it was just so weird. It's hard to explain because he just showed it through a picture, because he says it's easier just to show you through a picture. The difference between a normal heart and and Tristan's, so it looked like there was a wee something which was making it, I don't know, go around extra. But no matter what, it means then the blood is taking twice as long to get to his lungs. So obviously, that's worrying as his mom. That's scary. So, but unfortunately, with this virus thing, I don't know when this MRI is going to happen. So, but what I didn't like, don't get me wrong, I try not to be negative towards anyone, especially now we're at these dark days. But I did not appreciate the doctor saying to me, trying to justify why this was not picked up the first time. I mean, I didn't even say anything, so I don't even know why he had to try and justify why this wasn't picked up. He just says he says to me, I'm not going to say that Tristan was naughty, but, you know, he didn't make it easy for us to see the picture of his heart clearly last time. And I says, how about we don't use the word naughty at all, because my son has got autism, he's a learned disability, and he's mental delayment. And because of his disability, it was hard for you to see a picture of his heart. That's why. Not because he was naughty, but because of his disability. So, but I just really did not appreciate that comment saying, no, I'm not going to say it's because he's naughty. To me, that was not a very nice comment. So let's just say that the original consultant that Tristan's seen, I just liked it a little bit more. So there you go. So that's what we're dealing with Tristan. And obviously because now his heart, and then he's a severe asthmatic who he attends the children's hospital to be tested for his asthma. They check his lungs and stuff. So we are isolated. We are 13 days and we are not leaving this house until everything is back to normal, or they have a vaccine and we're vaccinated, and then we can leave. So that is us signing out. Bye.